Hi everyone, including people watching on YouTube. Hello, my name's Mike and I'm a PhD student at the National Heart and Lung Institute, and this is Uta, who's my boss. So we're here today talking about cystic fibrosis, or CF. We've put that up on the board behind you. Has anyone heard of cystic fibrosis before? What can you tell me about cystic fibrosis? Anything at all?
I think it causes mucus build-up, and it makes your mucus quite sticky, and it can, we can talk to.
So you can come and do this talk for me, because you know all about it. So cystic fibrosis, it's a disease that affects all the organs in our body, but it's particularly serious in the lungs. And just like the gentleman over here said, it causes a build-up of sticky mucus. And it's a genetic disease, which means that we get it from our parents. So you've all been given cards, and these represent the cystic fibrosis genes. And we've all got 2 copies of the cystic fibrosis gene. I've got 2 green cards, and these are the normal versions of the gene. Who else? Let's see what other cards you've got over here. So you've got 2 green cards, you're normal, and behind me, you have a green and a red card. So one of your cystic fibrosis genes isn't working properly, but you're all right because you've got a copy that's working fine, so you won't have the disease. But the problem will be is if you 2 have children, which, I mean, who knows what's possible these days? So you've both got 1 good gene and 1 bad gene. So you pass them on to your offspring in random combinations. You could pass on you could pass on your good gene, and you could pass on your good gene, and then it would be like over here, you wouldn't have cystic fibrosis. Or you could both pass on the bad gene, such as to you. You've got 2 red copies, and so you will have cystic fibrosis. So we call you carriers of cystic fibrosis. And if 2 carriers have children together, there's a 1 in 4 chance of passing the disease on. And so what the gene does is codes for a protein which sits in the, you can put the cards down now, by the way, you don't have to keep holding them. So the CF gene codes for a protein which sits in the lining of the cell. So this is the cell wall or the cell membrane. And this is the cystic fibrosis protein in the membrane, which is a pore, and it's there to let salt through. So if you use your imagination and think this is a salt particle, and it can, in a normal CF protein, it can fit through, moving in and out of the cell. But in CF, the pore doesn't work properly, so the salt can't get through, and it gets stuck in. And the reason this is important is that salt movement in the lung and in other organs also affects water movement. And if salt can't move freely, that makes the surface of the lungs dehydrated, so there's no water. We've got here kind of the mucus that you might find in your lung. And in you and I, when we have an infection, we get white blood cells, they come along, they fight the bacteria, and then we cough it up in phlegm or green jelly that was set this morning, and it's hot in here. It's now melted all over the table. But that's in you and me, and we can cough that up. In cystic fibrosis, the mucus gets dehydrated, and it gets all gunky and sticky like this, and you can't shift it. And then what happens as a consequence is you get bacterial infections that you just can't shift and you can't get out. But there are a few things that we can do. We have clever physiotherapists who have developed techniques for helping people get the mucus out of their lungs. And one example of that is a vibrating vest. Do I have a brave volunteer who'd like to try on a vibrating vest? You've tried it already. Come and try it again. We can all try. We can all try. All right. Have you come up? So this is a vest that patients with cystic fibrosis can wear. And the idea is, as you'll see, it vibrates the lungs, and that will shift this horrible sticky mucus and help you to cough it up and get it out. So we have to ask first if you're pregnant.
No.
Good. Shall I do the other one?
So the first thing that can happen is it will inflate. And maybe you can then just, describe to the audience what this feels like. What does it feel like?
My chest is compressed and difficult, I guess, breathe. It's all squashed, squeezing.
So do you think this at the moment will do anything to shift the mucus from your lungs?
No.
No. But wait for it now. So now, now describe what happens now. Tell us what this feels like.
Very vibrational. It's difficult to breathe, I guess.
And what do you think might happen to the mucus, which is very sticky in your lungs?
It will start to vibrate more and it'll start to move more easily.
That's exactly right.
Vibration of it move, I guess.
And how long do you think patients with cystic fibrosis have to do this treatment for?
Quite regularly, I guess.
Several times a day for maybe 10 or 15 minutes. And now we make you sing Baba Black Sheep. Do you remember the words to Baba Black Sheep?
I do, but I don't think I'd like to sing that. That's not funny.
We let you off then. Well done.
There you go, so that's a little bit about cystic fibrosis. Thanks for listening.